name is Maslin Smits. I'm a student nurse with the University of South Alabama College of Nursing, and today I'm going to be doing my central line checkoff. So I'm going to show you my ID, and now I'm going to scan the room. Okay, so the first thing I want to do when I walk into a patient's room is greet the patient and perform hand hygiene. So I'm just going to say, hello, Ms. Jones. My name is Maslin Smits. I'm a student nurse with the University of South Alabama, and today I'm going to be cleaning and changing the dressing on your central line. Okay, so now I'm going to grab my order form. I'm going to look at the medical order, which is number 15, and as well as follow the hospital policy. And then I'm going to do the two patient identifiers. I'm going to use the name and the date of birth. So Jaguar J. Jones, date of birth 08/25/1963, 08/25/1963. Allergies penicillin. And I would also ask the patient if they had any other allergies that were not listed on the patient care order form. I no longer need this, so I can put it away. I'm going to perform hand hygiene and provide privacy. I'm going to raise the bed to a working height. I'm going to lower the side rails and elevate the head of the bed just a little bit. And then the next thing I'm going to do is assess and palpate the dressing. So I'm going to look, and I'm looking for any redness, any drainage, any discharge, and I'm also going to palpate for any pain or tenderness. I'm holding it down because it's saran wrap and it's sticking to my fingers, but any pain or tenderness, as well as fever in the skin. And after I've done that, I'm going to move my bedside table, my simulated bedside table, close to my patient. That way I have materials real close. And that usually I would get something at waist height, because when I become sterile, I can't go below my waist, and I would just keep that in mind in real life. But this is what we have for today. And I'm going to move my trash can. And after I move my trash can, I'll perform hand hygiene. Okay, so the next thing I'm going to do is put on my goggles and mask, as well as my patient's mask. So I'm going to go ahead and put my mask on first. And then my goggles. And then my patient's mask. And my patient's face would normally be right here on top of the central line, but for today's purposes, this is how it's demonstrated. And then I'm going to put on my gloves. Okay, I'm going to go ahead and take off the dressing. So I'm going to peel up at the edges, making sure not to touch the hub. I'm going to peel off and peel towards the center, and also take off the bio patch. And once I'm doing that, I'm going to assess the skin and the skin integrity, as well as the port that the central line is in, or the incision the central line is in. Looking for any drainage, any swelling, or any signs of infection. And if somebody needed to take, or if a culture was needed, it could be obtained at this moment. Okay, so now I'm going to take my gloves off, glove to glove, and skin to skin, and throw those in the trash, and then perform hand hygiene. Okay, so after that, I said I perform hand hygiene. Now I'm going to move on to opening my sterile field. So I'm going to open my package and set it down. And since I already have mine pre-packaged, I'm just going to open it, being careful of the 1-inch borders. And if I didn't have it already pre-packaged, I would lay my sterile field out, careful of the 1-inch borders, and I'm going to be careful of them now, making sure not to touch any inside the 1-inch borders. So the next thing I'm going to do is put on my sterile gloves. So I'm going to come to the side over here. And I'm going to put them on. Okay, and now I'm not going to touch my wrist because I'm sterile now. Okay, and during the procedure, this hand will become unsterile and this will be sterile, and I'm going to make sure I'm not touching the two. Okay, so now I can move on to cleansing. They're both sterile right now, so I can reach into my package and I can grab my alcohol swab. I'm going to hold my central line. This hand is now unsterile. And I'm going to go in fanning motions, 2 to 4 inches around the dressing. Careful not to go over where I just went. With the same alcohol swab, I'm going to grab another one and cleanse. Throwing this, I'm using my glove container as my trash can. And now I'm cleansing one more time, 2 to 4 inches around. And then throwing that away as well in my package. Okay, so now that I've done that, I can use my chlorhexidine cleanser. I would normally pop this and it would make a popping noise and it would soak the sponge. And I'm gonna do it in vertical motions as well as horizontal and circular, getting underneath the hub and underneath the catheter. Making sure to scrub all over the skin. And I would do this for 30 seconds. And then after that, I would let it dry, being careful not to touch it until it's dry. And then the next thing I'm gonna do is pick up my bio patch. So since this hand is sterile, I'm gonna pick it up. I'm gonna place it right there. So I'm gonna place it blue side and words up. And after I've done that, I can set this back down. This hand is non-sterile, this hand is sterile. So I'm gonna go into my sterile field with my sterile hand and grab my container. Excuse me. Now I'm gonna take this off with the non-sterile part with the wrapper on my non-sterile hand and throw that away. And now I can place the dressing on this site. Okay, now I did that, I can go ahead and pull. I'm making sure to cover the hub when I put this dressing on. That way I will not touch it. There we go. Okay, and I'm gonna keep this to the side right now because I will be using that label in just a moment. So again, making sure all the sides are down. Okay, and after I've done that, I can go ahead and take off my sterile gloves, glove to glove and skin to skin, and throwing those away, as well as cleaning my area. So throwing all this away, and performing hand hygiene. And then I can go ahead and take off my goggles and my mask, and then taking off the patient's mask. And now I'm going to do the label. So I'm going to put the date, the time, and my initials. And I'll throw that away. And I would place this on the side. That wouldn't have happened, but I would place this on the side of my dressing with the date, time, and initials. And then after that, I'm going to perform hand hygiene. I got a piece of my finger. I'm going to perform hand hygiene and make sure that I lower the bed back to the lowest position. Make sure the patient is comfortable. Lower the head the bed back down if I elevated it. Raise 3 out of the 4 side rails. Make sure the patient has a call light and perform hand hygiene. And now I would leave the room and perform documentation. So I'm going to document the skin appearance, the drainage, the type, the characteristics, and if there was a culture taken and obtained. I'm going to document the cleanser that I used, the type of dressing I used, the patient tolerance, as well as the date, time, and my signature. And that is the end of my checkoff video. Thank you.